We're going to jump into our next panel, which will be focused on creating real connection and real impact. So this will be moderated by Josh Konechny from Momentum Life Sciences, and we'll have two panelists, Ann Myers from Immunocore and Samara Ashley, also from Momentum Life Sciences. So let's give them a warm welcome as they come up to the stage.
Right now, so thank you so much. It's great to be here in front of you all. So we're gonna go through I think this is a really good topic that continues from the last one that Valeris just had. If you remember, Valeris was going through kind of the FRM roles and then the nurse educator roles as well. We're gonna deep dive into that nurse educator side of things. So as you can see, our session here is accomplishing holistic patient support. It's creating real connections and real impact for those patients. What's important here is we're gonna go, a lot of times we talk a lot about, when we think about patient support, we oftentimes are thinking about access, getting patients access to their therapy. That is obviously one of the most critical aspects of patient support, but we're gonna take that a level deeper in terms of providing patients with holistic and personalized support to help them get access, to help them start their therapy, and to help them, as much as is appropriate, to stay on that therapy so that they can realize the positive health outcomes. So it's gonna be a big part of what we're gonna talk about. We're gonna look at the importance of these discussions and we're gonna give stories to the experiences that we all have with patients and helping them on their journey. So I'd like to start by introducing our team. I'm gonna ask our team here to introduce themselves. And Ann, if you can get started, that'd be great.
I'd be happy to, thank you. So I am Ann Myers. I'm the Director of Market and Patient Access for the US at a company called Immunocore, small biotech. So what that means is I am responsible for not only our patient support services, but also a team of field reimbursement folks, so patient access and reimbursement, we call them, so sort of a hybrid role. Been with Immunocore about 5 years. Before that, spent time with Lilly, which is where I started my pharma marketing career, which is most of my career has been in marketing. Also some time with Boehringer Ingelheim before joining Immunocore, and so I've worked across a number of disease states, from neuroscience to immunotherapy, diabetes, and now rare disease cancer. And so very happy to be here. My passion for patients started back when I joined Lilly and was working on the consumer campaign to introduce Cialis to the world. So if you remember those bathtubs, you can blame me for that one. But now my my passion for patients is really focused on supporting them through their journey and making sure we do everything we can to make their journey with a very rare form of eye cancer that has spread to be just a little bit better. So I'm happy to be here. Sam.
Thank you, Ann. I'm Samara Ashley. It's so nice to be here with you all. I'm the Director of Clinical Operations with Momentum. I'm actually a nurse. I've been an RN for almost 25 years, in healthcare for about 28, and I started initially in the hospital in ortho-neuro, oversaw physician practice for quite a while, moved into Director of Clinical Operations for launching New Home Health in the area where I live, and then eventually went into rare disease as a clinical educator on the phones and worked my way through, and now with Momentum, directing over all of our virtual operations, both clinical and non-clinical. So I'm so happy to be here. As you know, nurses love patients. And so the heart behind what I do is just making sure that we are providing the most excellent service that we can in any way. So from the very point at the beginning of prescription and the receipt of that patient all the way through to the end of their journey and their time with us. So thanks for having us.
Well, Samara, Ann, thank you so much. I feel very blessed to be here with you both. You both are experts, and you guys have been doing this for a long time. So kudos to you both. Also, thank you for Informa for having us here. I just want to say, for those, I'm a New Jersey resident. For those folks who are not from New Jersey, just East Brunswick is not a great representation of New Jersey, so I just want to point that out. For us New Jersey folks, I think we can all attest to that. So we're going to get started. I'm going to ask a few questions, and we're going to deep dive into these experiences. So first of all, we're going to start with the power of connection with patients. Would love for you both to share a little bit about kind of that nurse's personal connection and really like how that can make a measurable difference for a patient in terms of adherence and really that kind of emotional engagement.
Shall I start?
That would be great. Yeah,
All
thank
right.
you so much.
So our patient support program, KimTrack Connects, support patients who have a very rare form of eye cancer that has spread, metastatic uveal melanoma. It is exceptionally rare disease, right? We're talking hundreds of patients a year versus thousands. And so a patient who has this disease may have not ever met anybody who has it and feels, kind of isolated, alone. And so it's really important through our patient support program to really build a human connection with that patient, for the patient to understand that the nurse really does understand that disease, can actually help them even understand it better as need be, and really can support them, has a kind of gets it in terms of what they're going through where they may not feel like others in their lives do. And so that's kind of just an important context to the conversation. So our nurse case managers reach out to patients who are enrolled in the program on a regular basis. It's very patient-driven as to how often. But in the example that I want to share, we had the nurse reach out to the patient at their regular time. And this patient who they'd already built some level of relationship with, who was normally very upbeat, sounded down when he answered the phone. And so she said, hey, what's going on? It's nice to talk to you. You don't sound like yourself. What's going on? And he said, well, I'm kind of bummed because I feel like I don't really have much of a say in what my treatment path is going to be. And, I'm a little bummed about that. She was like, well, tell me what's going on. How are you feeling? Well, I feel really good. But I don't feel like my doctor is kind of seeing things the same way that I am. Well, have you told your doctor how you're feeling? She encouraged him. Well, no, I haven't. Well, why don't you go back and tell your doctor how you're feeling physically, what you're thinking, and why don't you two work through it together? And he was like, okay. So he, several weeks later, they had their regular touch point, and she said, so how did it go? And he's like, oh, I'm so glad you gave me that advice. I talked to my doctor, told him how I was feeling. We kind of talked through our options together, and together we aligned on what my path forward was going to be, and I feel so much better about things. And so that's one example of how just having that human-to-human connection, knowing what is normal for that patient, what his normal temperament would be, being able to pick up on the cues that things weren't exactly where he wanted them to be, and then being able to encourage him to go back and kind of share his feelings and share decision-making with his doctor really made a difference for this patient.
That's so great. I have another story to share as well. One of the indications that we support with Momentum is a specific type of seizure disorder, both for pediatric and adult patients. And oftentimes we are actually connecting with the caregivers versus the patients. And there was this one call, and I have to share this because I went back to listen a year later and just to see where they started versus where they ended. It was so impactful, and I thought you guys might want to hear this today too. So at the beginning, in that very first call, talking about human connection and how important it is, our educators are so well-versed in knowing how to show compassion and build a really quick rapport over the phone. And that's sometimes you can train to that, and you also need part of that natural ability, right? So this call, again, was the mother of an adult child who is nonverbal, and the first thing that they started talking about at the very beginning was just, hey, why don't you just pause a minute and share your story a little bit of how you got to this point. And one of the best ways, right, to build a connection with individuals is just to listen. That active listening and that connection that can be built. And the mom went on to share how, her child is already on multiple therapies, and now they're having to add this one. And it was a very new concept. At the moment of prescription, that as soon as we get them in, typically it's a 24-hour turnaround, and we make those connections really quickly, but we catch folks oftentimes at a very confusing point. They have a lot of phone calls coming to them. You know, already this mom's a full-time caregiver for her child. And she's done so for so long a period of time. So her time and her needs might be different than somebody we talked to earlier that was a completely different story. And so the nurse did such a great job just connecting and listening to the mom. And I listened to the first call, and then I waited and listened all the way back through, because you could hear the hesitancy, you can hear the lack of confidence at first, and just that active listening at first. It was a lot of emotional support throughout that whole journey. And then I went back the other day and pulled that 1 year call. And it was just totally different, to your point, Anne, when you go back and you hear the beginning and you hear the end. And there was almost this, you know, celebration. And the nurse had got to know her child so well. He was making sounds in the background and interacting as best he could. And they were getting ready to celebrate the holidays with family. And she said, you know, he's more verbal, not speaking, but more verbal for what he was doing now. And he's come back to himself. Like, I can see his personality now showing through. And it just gives me goosebumps thinking about that and listening back. And then she's like, you know, thank you for helping me. I can't believe it's already been a year. And when the nurse said, hey, this is kind of the end of my outbound calls for you, she's like, what, we're done? And so we were able to take that information back through our client solutions team to the client and say, listen, you know, your patients and their caregivers are wanting more support longer. And what a great thing to have. And they were able actually to then think through and extend the opportunity. So it was just a really neat celebratory call. And for a time that was really, really difficult in their own lives, we were able to be that, you know, support within the bounds and boundaries of what we can do. We were able to just be a listening ear, a guiding light, and get them through some of the difficult circumstances.
That's great. Thank you for both of those stories. I think in both of those cases, it's what would have happened if that support wasn't there, right? What would have happened if we were just focusing on access? And it's really interesting to think about. You know, you could have had two discontinuations and very, very different stories. So that was great. Thank you for that. Our company, Momentum Life Sciences, we provide patient engagement and support services to pharmaceutical clients. We've been doing that for over 30 years. Really, our goal is to help our pharma clients, you know, give access to and give that support to patients so that they can be on their therapies. And so with that, I want to go into the next question. So when, you know, what we're doing as an organization was we're designing and we're building and we're executing on these programs on behalf of our clients. Let's talk about how we build these types of programs, and really from the beginning, like, what are the best practices that we're looking at? Samara?
I think, you know, you got to really take it back to the very beginning of, if you want a call like what Ann and I just shared, and the compassion and human connection that comes across, you need to take it all the way to recruiting and hiring. Right? How can you determine? So folks can take skills tests and you can get a profile on them, but really it takes a human in that interview with another human and say, can I feel connected in this short time with this person that I'm hiring to fill this role, to then connect with our patients and caregivers? And that's a hard job sometimes, to really in a short period of time find somebody who portrays empathy in their normal conversation and who can instantly connect. And so that stands out a lot to me. We have all different ways that we do it at Momentum, and it takes constant tweaking of that process to ensure that we're really hiring the best people to support the patients over the phone.
Thank you, Samara.
And we use a partner similar to a Momentum, so they're the ones who are doing the hiring, but I ask when they're looking for talent for our nurse case managers, there's two things I'm really looking for. One, are they an empathetic listener? Do they have that real desire to connect with somebody on a human-to-human basis? Because that's critically important and really hard to train if it's not already there. And then the second thing is, are they a problem solver, right? Are they looking to maybe uncover those challenges that the patient may not have even known they had, And then can they be resourceful in figuring out how to solve those problems for the patient, of course, within the bounds of compliance. And I feel like if they've got those two things, we can train everything else, and we will train everything else. Depth on the disease state, depth on the product, and how to make sure that the patient knows exactly what to expect. We will train all that, but they just need to make sure that they're an empathetic listener and a problem solver at the end of the day.
I'm going to go off the record real quick on this. Are there situations where the training needs to be optimized over time? Like Sam, or at least at our company, what any thoughts there?
Oh yeah, I have a lot of thoughts on training. I'm very passionate about training, and I think sometimes we need to constantly reassess what does our training look like. I have a great partner who oversees all of the training, and she's amazing. And we often have conversations to, okay, how is it going on the other end? One of the things I know we've talked about a lot is their confidence in coming out of training to be able to do their job to the best of their ability. So assessing your length of time that you provide training, because there is such thing as too long, I believe, from a clinical standpoint. And then are the tools and the trainings that you're providing matching up with your expectations of those best connections and what those calls sound like? So if they're not listening to great calls during training and at the very beginning, what is my job? Often, I came as a clinical educator, remember? So sometimes in past jobs, it's been, we're gonna train you to all the basics, but you never really hear what your job is really gonna be doing and what you're supposed to be providing at the end of it. So giving them that at the very beginning with the understanding of that clear purpose, which is really just serving patients and caregivers.
That's great, thank you. Anything to add, Ann?
I think just making sure, sometimes they're drinking from a fire hose at the beginning. And so making sure that, they feel like if there's something that we need retraining on, they feel open to be able to share that versus, oh gosh, I'm going to be judged if I share that, right? That they feel like they can always come back and ask for a little bit more.
Yeah, I think it comes back to confidence. Like confidence is just such a key part, and we've been talking about that as we've led up to this. Confidence is just such a key part to this, and giving the nurses the confidence to support patients. All right, I want to dig. So we talked about the human aspect of it. That's extremely critical. Let's layer on top of that the technology aspect of it. Right, so how are we using technology to help the nurses to be more efficient in what they're doing, but also to provide different ways to engage with patients as well? So I'd love to hear a perspective there.
I can start with the patient engagement part of it.
That'd be great.
So it's really, our program is very much about meeting patients where they are. So there's some people who want to talk on the phone for 45 minutes every week. Okay, we can do that. There's others who are like, just email me. Let's communicate via email, and we can accommodate that as well. So it's really very patient driven. Most people fall in the middle, right? They want to have some conversation, but they also, send me what we just talked about so that I can remember it later. Somebody in an earlier panel, I think, mentioned about 25% of what gets discussed gets remembered. So to help them have a reference and things like that. But really, most people are somewhere in the middle, and they want some, send me something via email, but let's have a conversation as well.
Great. Yeah, Samara?
I love tech. I love digital opportunities and components to a patient journey, but I think it's all in how it's used to not oversee and override that definite human connection that's really needed. There is such thing as digital empathy, and it's something I've been researching a lot as I'm always striving to just find new initiatives to push forward and improve constantly. And our teams, actually, our nurses and our non-clinical teams, everybody's so insightful to provide the feedback to then be able to go further and just tweak things over and over again. And digital empathy is one of those that we strive and push so hard for our educator teams to be empathetic. But do we oftentimes forget the messaging that goes out between all of the human touch points, and how are those messages received? Are they received in the same empathetic and compassionate messaging way that we want, and that's just as engaging? So I think we can utilize this so much, though, and tech, to me, provides more efficiencies for the frontline. For us, it's really important that they can focus on their call and be uninterrupted. So if we can use tech to do more of the administrative side of their job, and then at the end, when they're off the call, they can double check and wrap up their work more efficiently. Just being able to stay focused is really important.
That's great. Thank you. So just to continue with the technology theme, so to speak, let's talk about the efficiencies that technology brings to our nurse educators. Even from an AI standpoint, would love to hear thoughts that you both have, experiences from the two different companies.
You want me to go on this one?
Sure.
Okay. I think the biggest thing with AI usage, it goes back to what I just said a second ago. I probably jumped the gun, but being able to provide them real-time tools so they're not, if you think about it, oftentimes as educators, we have so many approved resources, right? Think about all the different approved resources across any given program that you oversee. And instead of having to go and look for and pull and search while I'm trying to have a conversation and be so engaged, we can use AI and automation and tools to pop and provide the information real time as they need to. That's one of the most amazing things that I really love is it goes back to what I said a second ago. What can you provide them real time so then they can solely focus on the conversation, staying compliant and staying within their boundaries?
Yeah, and our use is very, very much along the similar vein, right? So how do you take the tasks that are mundane, give those to AI, taking the notes, filling out the form, whatever it might be, so that the nurses can focus on what is the humane part of it, right? Get rid of the mundane, focus on the humane, and be fully present, fully engaged in that conversation with the patient, pick up on the cues, be able to have, that meaningful, empathetic listening and support conversation versus, wait, let me quick take a note, so.
Yeah, I think it's great. So efficiency, so they can continue genuine human connection. So not taking away from the genuine human connection.
Yeah, and then Samara, for instance, like natural language processing, like let's talk about that for a second in terms of the insights that are then generated for those conversations as well. Any perspective you can give kind of real world with clients that we're working with?
Yeah, I know sentiment's a big one. Anybody in here look at their sentiment scores and all of that. I think it's really important. So it's great and it can pull out very specific content. Like, so if I'm needing to pull calls related to, let's just say, a specialty pharma shipment issue, and I need to gain insights specifically for maybe QBR or client solutions needs some conversation pieces. We can go and we can pull specific data. But to me, I think it's really important. Something I've learned with the sentiment is, just because there might be a negative sentiment score, that doesn't mean that the call was negative. And I think one of the learnings lately that I haven't used it a lot recently, but if you have a shipment issue or a replacement need, or maybe the individual that you're speaking to, the patient or caregiver, is having issue with their disease process, or they're having a flare, whatever it might be, those can come across into negative sentiment when the overall call was actually really positive and supportive. So I think there's great ways to utilize those tools, but we still need to be assessing that from a human capacity.
Yeah, that's great. I think like the sentiment's a really important aspect. One of the ways that we look at sentiment scores is going into the call and coming out of the call. Where has that change been? And that's such a great way to work with our nurse teams on performance management and helping them, to continue. And that goes back to the training process as well. It's such a great way to be able to assess that. So I want to ask. I have one more question to ask. First of all, I want to ask the audience real quick. In 1 week, it's Thanksgiving. Who here is hosting Thanksgiving at your house? That's a lot of people. Okay, wow. Good luck to all of us. I personally do the turkey, so it'll be a challenge. All right, so bringing it home, want to ask a really big question of our panelists here. So for the organizations out there, all of our pharma friends out here looking to elevate those patient support models, what are really like the practical changes that they could look to address based on nurse education, based on holistic support, adherence support, things like that? So would love to hear thoughts that you guys have.
You go ahead.
I mean, I think you just have to always keep the patient experience in mind. I mean, that at the end of the day is the North Star. So whatever piece you're working through operationally, think about the patient experience. And so that is certainly something that we try to do. As I mentioned, we support patients who have a very rare and deadly form of eye cancer. And so they're dealing with enough in their lives, right? I actually heard directly from a patient that I was talking to one time. He's like, cancer is a full-time job. If they've got this full-time job they are dealing with on top of everything else in their lives, and they probably don't feel great because of the disease, what can we do to make their life a little bit easier, right? In every interaction with the nurse case manager, making sure there's that empathetic listening, right? Even if they're having a terrible day, we've even had some patients say, boy, I'm so glad I've got them because I don't feel like I have to burden my family or my friends. I know that they're going to listen, which is great. But, anything you can do, whatever problem they need solving, the easier we can make life for the patient and or the caregiver, who we also engage. We've had a patient recently who had, I think, 4 different family members calling on his behalf. And so, every one of them that we can make their life a little bit easier by just listening or helping to solve a problem, I mean, that's where we want to focus.
And
how do we think about the patient experience?
And that's the same person they're talking to, right?
Yes.
It's like, so they know the family from that standpoint.
Exactly, yeah.
That's great. Thank you.
Sure.
Samara?
So the one thing, right?
Well, you can say more than one,
I might have
but
to.
unless you have one really good thing, I mean.
It's hard to have just one. I think in order to ensure that you're really providing what Ann just spoke of, that best, most excellent, I always like to say, like the most excellent adventure. What is that from?
Bill and Ted?
Yeah, probably Bill and Ted. Sorry, that sticks in my mind. I guess it's from the 80s or 90s. But I think of that from a patient perspective, though. Like, so how do you know? You need to just listen to the calls yourself. If you have never listened to the actual calls beginning to end, or been maybe a secret shopper and called in yourself as a patient experience, you will never know the experience. So listening to the calls, not only is it really rewarding anyway, if you're part of a program or you're about to launch a program and maybe you've been active in a program for 10, 15 years for the same therapy. If you haven't listened to the calls, you'll never truly understand, A, what's needed, B, the gaps and barriers. One of the things that I find that's so important from our educator perspective is the insights that you will gain if you just talk to the folks that provide the service. So please, whatever you do, listen to those calls. And the other thing I wanted to add, if that's okay, as a number 2, even though it was one thing, is make sure that the services you're providing are valuable to those that are receiving it. So what value does the patient or caregiver earn what do they receive when they're actually on the phone with your patient support? What value is there for them when they're caregiving full time for their adult disabled child and, feeding tubes and changings and probably not having a break and worn down? What value can we provide as an educator to them where they will want us to call them and they will want to engage and they will want our support and see the benefits from that? So I think that was the other thing I wanted to add, is just make sure you're providing value.
Yeah, I'm glad you added the second part. That was great. I want to add something, and that is a lot of organizations have to use call scripts. So it becomes a little more robotic in terms of the support that's being provided, especially when you're looking at Ann's brand and therapeutic area. That cannot be robotic. That is, absolutely not. That would be insane. We're seeing a significant movement into call guides, into personalization, into kind of being there and meeting the patient on the patient's terms. It's such an important aspect, whether that's in person, whether that's virtual, telephonic, whatever that might be. So it's really trying to urge your organizations to make sure that you're providing call guides to these teams instead of scripting the situation. And then the last thing I wanted to say, I was just thinking this, is some of the best partnerships that our organization has with pharma are those that we get our nurses are just really involved and immersed within the culture of that organization even. They're a part of QBRs or even at national sales meetings, things like that. That's such an awesome best practice. Let's get those nurses knowing, key people in the organization and being able to kind of give the real world aspect of here's what's going on every time we're engaging with those patients. So just a few thoughts that had over here. So we're going to wrap this up. I just want to ask if there's any other closing comments that you both have, and then we'll get into questions.
Can I add to what you just said, actually?
Let's hear it, Sam.
So I love that we have call guides. It's important, right? I think if you're looking into that, or maybe you're about to launch a new product, if you wrap in your frontline educator teams who have probably done this for a very long time. I know I was on the phones for 13 years doing that job. And if somebody had just asked, hey, how can we make this better? How can you sound more engaging and more empathetic in conversation? And I think Momentum, some of my folks are in here, they do a really great job of explaining that to the clients and saying, hey, let us help adapt this and make it the best from the ground up from the very beginning. And we get to work, the clinical team, the client solutions team, with the client, and we can create such a better opportunity from the very beginning, and then have those opportunities later as we get insights to tweak it as we go. So I think that is very important when we're talking about real connection, to constantly, again, go back and reassess how it's going after the fact.
Yeah, that's great. Thank you, Samara.
Yeah.
Anne, any other closing thoughts?
Yeah, I think just the patient stories that we hear, right? Being able to certainly take out the PHI, but to be able to share those with other people who work on the brand, who are out there kind of fighting every day for patients, being able to share some of those stories, I mean, it's the most motivating thing that there is. So I think, another place where just everything that we do, listening to those calls, listening to the nurses who have those calls, and being able to encapsulate a few things and share them out more broadly is just incredibly motivating.
Yeah, and then to your point earlier as well, depending on who all is involved from that project or that therapy specifically, making sure all the dots are connected. So oftentimes, we might not be virtually, of course, in my role, we might not be directly connected to the HCP offices or the field teams or the sales teams, of course. But if your sales teams and your field teams or your HCPs aren't aware and don't understand your patient support service program, it's never going to be what it can be. So finding those ways, and like you said, inviting a nurse panel to a conference, or bringing them into a QBR like we often do, and bringing part of those teams in and really helping bridge the gap and understand, like I remember as an educator, oftentimes we get pushback sometimes from HCPs because, those nurses might be telling my patients to do something different. Well, in reality, we're actually really supporting their therapeutic regimen that they've prescribed and all of that. But if they just knew it, they would be so much on board with their patients being enrolled. So I think that's a really big piece too of the overall patient being supported through that.
Yeah, we've run into that same challenge too. And as soon as you say, our nurses are not giving clinical advice, oh, well then what are they doing? Yeah. And then you explain what they're doing. It's, oh yeah, I absolutely could use that. So. Right. Yeah.
I mean, why not? Right? I mean, the doctor's offices are too busy to do any of that. Just want to say, so thank you to everyone for being here. Look, this is, the types of support services we're talking about are not for every single brand. We get that. It really depends on the situation. Really, ultimately what we're talking about is how can we kind of hold the patient's hand? How can we walk them through the beginnings of their medication, mastering that regimen therapy, and then helping them through ongoing therapy management? Sometimes it's emotional support. Sometimes it's that holistic support that really helps get that patient, into a better state. That's what we're talking about. And then again, how can we utilize technology to make all of that more efficient, both in engaging with the patient as well as supporting these nurse educators. So I would love to turn it over to the audience, see if there's any questions for our panelists here. Please don't be shy. And you can also ask a Thanksgiving question if you'd like.
Thank you, guys. Great panel. There was a question or a theme to an earlier panel about culture and kind of getting buy-in and support for change at the top, and I'm thinking about it in a different context here. We were talking about breaking down the program at a really granular level and trying to get that feedback and what really happens on the calls and trying to meet the patient where they are. Are there other things you guys do to share some of those anecdotes and those stories internally to drive kind of more air cover, if you will, over just like investments in these programs and the important work that's happening on, with the teams that are engaging directly with patients?
I've got a good example. So when I was at our home office, our CEO is very patient-centric. And I just set up time with her and wanted to tell her a story of something that had recently happened where kind of all the different pieces and parts were working together. So there was a patient who had been offered the therapy, wasn't sure they wanted to start or not, called our patient support line that was able to find online and started just initially asking cost questions, but then got into, a real conversation with the nurse case manager, decided they wanted to enroll right there on the phone to get more depth. And this nurse case manager spent, I think, close to an hour talking to this patient, understanding all of their concerns, doing some education. And then at the end of it, the patient was like, okay, I think I am interested in starting, but my doctor wants to send me 2 hours away to a big city, and this was a rural patient. And I'm not comfortable doing that. I'm willing to start, but only if they're going to start near me. So then, it was like, all right, let's work on this. So that nurse case manager let my patient access and reimbursement person know about it, who then got in contact with the local site of care. Can you do this? Can I bring in a medical science liaison to make sure you guys are ready? By the way, this was a Friday afternoon. The patient wanted to start Monday. So everybody spring into action, right? So gets a hold of the medical science liaison, who, by the way, was at the airport, headed for a weekend getaway. I will be there Monday morning. We're going to make sure that everybody is educated. Let's let our oncology account manager know so they can get in there and do an in-service as well and make sure that everybody who's going to touch this patient, right, the nurses, the hospitalist, whoever, understands. And this was a site who had never started a patient, had always sent them a couple hours away and said, well, if this is the only way this patient's going to start, we're going to make it happen. And everybody kind of came together and worked on behalf of this patient, and it all started with a phone call to the support program. So I think because everybody knew kind of what each other was doing and how it all could work together, it worked seamlessly in that particular case. And after I told that story to our CEO, she was like, everybody needs to hear about this. And so I'm going to be speaking at a town hall all about our patient support program and what it does to, our global employees. So then everyone's going to know, and hopefully that's also going to encourage people to talk about it more often and get more patients to hopefully benefit from the program.
I love that. I'll just piggyback on to what she just stated. We use a lot of our patient experience, our stories in our town hall as well. And it's a great way to motivate your company. It doesn't matter if you're IT, doesn't matter, if you're in compliance, if you're in whatever department, like to have everybody equally listening because they all have a piece of the impact being made on that call, because of all of our work in combination together. And so I know oftentimes we sit and we listen, and it's great because the clinical educators themselves hop on the town hall and they're the ones sharing it. And sometimes, a lot of times there's tears, depending on what project we're talking about. But the impact that can be made across your entire company to hear, it just motivates. And then we can talk about why it's so important that these insights matter and why they need to be brought up and why we need to break down those barriers and bridge the gaps and provide that, because ultimately it's going to impact so many more patients because of those insights, even like you just provided. So it is really important. It's very motivating. I get goosebumps lots of times just listening, and then it gets you pumped up to keep doing what you're doing, because if you keep going with your glass almost empty, how do you fill the cup, especially in like a virtual and remote environment with your teams? This is one of the best ways to do it.
Those were great answers to a great question. Thank you for that. Any other questions?
Hi, I have a question. I'm really just thinking, there's so much positive, right, of building that connection and whatnot, but you have the limitations of not providing the clinical advice. How do you work with your teams, especially if you're establishing programs, to build the appropriate guardrails? And especially if your nurse educators are coming from bedside practice, transitioning them to sort of their appropriate swim lane in industry versus what they have done for decades of time.
Do you want me to take that one?
Yes.
Okay. We do this a lot, actually, and coming from the bedside, until somebody offered me my first virtual specialty rare disease role, I didn't know that either. So I can give you my personal opinion, and then from hundreds of educators that we brought through. But first of all, it goes back to that very initial recruiting, interviewing, training, and understanding of what is this role. So it goes back to, if they don't understand the overall picture, like we do a day in the life video that we actually show prior to their interview with us clinically, where they have to actually see, what does this role look like remote? What can you do and not do? We kind of make it funny. Little things that, we're not like doing our laundry and our dishes while we're walking around with a headset with our kids in the background talking to patients. So, but I think it's really important to really see clearly what that is at the beginning. And then the boundaries come in really in training, and then I call it a nesting phase. When the manager takes them from training, they really dig in and assess at that point, do they fully comprehend our compliance? Let's have these conversations, and then it's through call monitoring and auditing from there as well. So it's just, again, for me, it's just the clarity of what is my expectation for my role, what can I do, what can I not do, and just being very clear and concise with that messaging from the beginning. It's very helpful as a nurse, coming from my perspective. It was just very helpful to hear, this is what you can do, this is what you can't, and if it's in the approved resources, that's what you can speak to. Anything in there is free game. So, yeah.
From the patient side, right? So the patient starts to ask questions and is hoping that the nurse can provide more insight. How
Right.
The nurse educator handle those?
That's a great question, and that would be a great question to talk to your healthcare provider about. So let me just kind of help you help yourself. How do you bring that up for discussion best on your next visit? When's your next appointment? Can you write that down now while we're talking? And then I'll follow up with you after to see how that went. Yeah.
Of course, if adverse events are mentioned, there's a whole process for that as well, obviously. Sorry, go ahead. And anything?
I was just going to say, she trained right on the spot. That was great.
Any other questions?
I think we're good to go. Thank you both so much.
Wonderful. Thank you, everyone. Really
Thank
appreciate
you.
it.